Stroke is the third leading cause of death in the U.S., the leading cause of long-term disability, which is why May is dedicated to raising awareness. And right here in Central Ohio, we're lucky enough to have the resources we need to help ourselves or a loved one recover. At the OhioHealth Rehabilitation Hospital, it's all about one common goal.
I think initially it's very anxiety-provoking and scary.
On average, someone in the U.S. has a stroke every 40 seconds.
Maybe they can't talk, move one side or the other. Maybe they can't feel their limb. They don't even know where their arm or leg is in space.
And like many diseases, the path to healing isn't a one-size-fits-all approach. Occupational therapist Amy Cowgill likes to use an analogy.
No two strokes are the same, just like snowflakes. Initially, we have to evaluate the patient, get to know the patient, and really uncover what their deficits are.
And when it comes to a stroke, there is a laundry list of risk factors, things that cause a sudden interruption of the blood supply to the brain.
Such as high blood pressure, diabetes, smoking, high lipid levels in the blood.
So how do you know if you're having a stroke? Dr. Julie Rindler is a physical medicine and rehab physician.
If you develop sudden confusion, headache, slurred speech, numbness, tingling, weakness, balance difficulties, that signals that you need to get to the ER or call 911 right away.
That's where the OhioHealth Rehabilitation Hospital comes in. The German Village inpatient facility is all about the hands-on approach. Amy works on reestablishing that mind-body connection that patients lose after having a stroke.
We focus on training patients in activities of daily living, self-care, bathing, dressing, all the necessities that patients need to return home.
But as they say, it takes a village. Each patient has a team at OhioHealth Rehab, while therapists focus on occupational, physical, speech, and recreational healing.
We have our physical medicine doctors who guide the teams and guide the care. We also have very experienced case managers. We have dietitian, we have pharmacy, we have 24-hour nursing care, psychology, respiratory therapy. The list goes on. It's very comprehensive care for the stroke patient.
And much of the work happens here, the therapy room. Patients spend hours a day with equipment geared towards balance, strength training, and coordination.
The brain is an amazing organ. It has the ability to rewire itself. And what that means is the healthy parts of the brain can compensate for the damaged parts.
Amy is also the clinical chair of the hospital's stroke program. Dr. Rindler is its medical director. It's a special group of staff members that come up with best practices for the hospital, whatever it takes to stay on the forefront of their industry.
We share ideas, we troubleshoot every day. We sit down formally a couple times a week and try to figure out the problems and how we can develop solutions. So it's many minds working together to get a better outcome.
They even offer weekly classes and a stroke mentorship program.
I think that support, that emotional support, is so essential to their recovery. And when they think about where they are now, and then they see somebody that has already been through the process, it gives them so much hope and inspiration.
And anyone who's been through a devastating life event like a stroke knows that hope and inspiration aren't always easy to come by. So OhioHealth Rehabilitation Hospital keeps that central to their care. They also stress prevention, saying there are simple ways to keep strokes at bay.
A healthy lifestyle in terms of eating right, exercising, and making sure we have a little bit of fun every day. We never know when our number's going to be up, so we need to take every day and do something fun, enjoy, and who knows, that may even help in our stroke prevention.
A little fun in hopes of seeing a lot of progress. The OhioHealth Rehabilitation Hospital has one ultimate goal: to get every patient where they belong, home.
This is an amazing setting where we create the building blocks of a patient's recovery, and that recovery happens so quickly. So when a patient comes in and we evaluate them and we see them in that state, and they walk out of here without a device, with a smile on their face, that makes everything worth it.